When we're thinking about pregnancy, we know that there are going to be hormonal changes that will occur throughout the body, right? And that's going to affect a woman's teeth. It's going to affect her gums. For example, when we think about the bone and the ligaments that support the teeth during pregnancy, those might temporarily loosen. And as a result, you may have more tooth mobility. However, usually a woman is not going to experience the loss of a tooth or the loss of teeth unless there are complications on top of that. So it's very important for women to see dentists to help prevent those complications that could in fact lead to tooth loss during pregnancy. But I do think in her particular case, maybe the pregnancy played a role because you do have those changes. But as you mentioned, there probably was more going on there.
Yeah, and you're right. I mean, hormones go crazy, and there's a massive increase in relaxin. We know that that loosens your ligaments. In fact, there's proof that it does to the ligaments that hold your teeth as well. Some people have even reported that they've had rapid orthodontic movement with braces during pregnancy due to that. So if your teeth start moving during pregnancy, please call your dentist. You might just need a retainer. It's rare, but it could happen.
So any questions that you'd like to ask Dr. Dorfman?
I would like to know, is there any way to scan, to take a test to find out what your teeth health really is?
Probably the best thing for you would have been to have had a full set of x-rays, before the pregnancy and see what the health of your teeth were and the bone level and all that. And the other thing too is, just like cancer, early detection is paramount to solving a problem. If you have a little tiny cavity and we catch it on x-ray, we just fill it. If you wait a year, and now it's a root canal, a crown, or maybe even an extraction and an implant. So it's really important that you get checked right up front.
And I want to stress to viewers, I feel as though during pregnancy, a lot of patients will intentionally avoid the dentist. Well, we shouldn't do that. I think that dental care should be thought of as a very important part of your overall prenatal care. And a lot of times there is misinformation out there. So you're not sure about what you can do at the dentist's office. You can always talk to your women's health provider if you need a specific procedure, so they can help guide the dentist to say, okay, yes, she can take these medications, you should stay away from this or that. But according to the American College of Obstetricians and Gynecologists, as long as you shield the abdomen and the thyroid, dental x-rays are okay during pregnancy. And they also go on to say that if you need a procedure like a root canal or an extraction, or if you have cavities that need to be addressed, then you can safely do those things at any point during your pregnancy. But once again, if you have any questions at all, don't just avoid the dentist. Instead, have your women's health care provider talk to your dentist, and they can come up with a plan that's safe for you and your baby.
The other thing that women need to know is that the CDC has definitely determined that 60 to 75% of all pregnant women suffer from dental disease. Dental disease, well, what is that? It's typically pregnancy gingivitis. And the best thing you can do, as you said, Doc, is go to the dentist. You should go. Normally we get our teeth cleaned every 6 months, but some people during pregnancy like to go every 2 to 3 months because they are having gingivitis and they're having bleeding and all that. And the worst thing you can do when you're pregnant is to stop brushing and flossing. And a lot of people think, oh my gosh, if it's bleeding, no, don't do that, because then the bacteria and the plaque sit there and it makes it worse. And you have a new problem. Decay, tooth decay. If you're not cleaning that plaque and that bacteria off of your teeth, you're going to not only have loose teeth and bleeding gums, now you're going to start getting cavities all over the place. So you really have to have meticulous oral hygiene.
Great advice. I think we have it well covered for you women out there that are pregnant or considering getting pregnant. Alicia, thank you for sharing your story, and good luck with everything. Dr. Dorfman, as always, you came ready with great information.